They're joining us right now, a member of the Freedom Caucus, which until now at least opposes this measure, Republican Congressman Jim Bridenstine of Oklahoma. Congressman, thank you so much for being with us. Let's be clear, as it stands right now, if the vote were today, would you support this bill?
I, in fact, would not, and I think there's a lot of concern from a lot of members, of course not just me, but there's also a number of senators as well. Some very serious challenges. Our goal is to make sure that we bring down premiums, bring down the cost of health care for all Americans, increase access, and in our estimation, this bill will not accomplish that objective.
When you talk about access, you've got, S&P Global saying 10 million people could lose coverage. You've got Brookings saying as many as 15 million people could lose coverage, largely because of the Medicaid expansion ending. But your speaker, House Speaker Paul Ryan, said, quote, "This is the closest thing we will ever get to replacing and repealing Obamacare." How do you respond to that?
Well, I don't think that's necessarily accurate. I know the Freedom Caucus met with the president just yesterday. Our leaders did. Mark Meadows, Jim Jordan. They had a great conversation. They indicated that the president is open to changing the bill. He is not wedded to the bill in its current form, and he wants to work with conservatives. So I think all of this is very important. And again, our objective is to increase access and bring down costs. And when you think about the Medicaid expansion, as you indicated, what we have to do is actually bring down costs so more people can get covered. The Medicaid expansion is actually going into the middle class and providing able-bodied working people coverage that they don't need. Under the current plan
Congressman, it's also providing a lot of very destitute people coverage.
Absolutely. And I will also tell you that under the current plan as it stands, I will get a refundable tax credit up to $3,000 for me to buy health insurance. And I don't think anybody supports me as a member of Congress getting a refundable tax credit. But that's the kind of thing, it's available to all Americans on the individual market. But we don't have to solve this problem by creating even more entitlements, even more subsidies, even more cost to the taxpayer. All these things drive up the cost to the person buying the insurance.
Let's be clear then on 2 points. You just brought them up, and I want to know if those changes will get you on board this bill. If the president, and there's some signs that he may be willing to give here, if the bill changes to sunset that Medicaid expansion earlier, would you vote for the bill? Is that enough?
Certainly, that's a good starting point. I'm certainly not going to come on this show right now and tell you that that's going to make it happen. This is a good starting point to begin discussions.
What about tax credits? If there are those tax credits, if they remain in there, the tax credits you say to you that would give you $3,000, if any tax credits remain in, could you then not support it?
So here's the situation. One of the reasons that you see the cost growing so fast is because of all the subsidies available on the Obamacare exchanges. Well, what we're doing is we're taking those subsidies on the Obamacare exchanges and we're replacing them with refundable tax credits for everybody who buys insurance on the individual market. Ultimately, that drives up the utilization, it drives up the costs, and then nobody can buy insurance unless you ultimately get the subsidy. And there's a whole lot of people in this country that don't need the subsidy, and all that's going to do is drive up the costs. And that's not good for the taxpayer, it's not good for access.
So that sounds like a no unless you do something about the tax credits. Correct me if I'm wrong. If I'm correct, let me ask you this question. Where's the president on this one? Do you want to see the president out more making the hard sell on this? He is the art of the deal guy, but he hasn't been in front of cameras taking questions on this. He hasn't been out doing interviews, even with favorable outlets trying to push this one and make the sale. Would you like to see a little bit more of the president?
Certainly, I think the president is doing the right thing by keeping an open door. The president is doing the absolute right thing here. He wants to hear from all players, and he is not wedded to the current position, and he has made that clear. He wants to come to an agreement where we can all get on board. And I will tell you, my friends in the Freedom Caucus and others in the House of Representatives all want that to happen, and the president is doing the right thing. I would also tell you there are ads that are being run in some of our districts all across the country, basically making it a false option that you're either for Obamacare or you're for the current plan. And that is not an accurate description of the situation. I will also tell you that the President of the United States is not behind that tactic. The President wants to hear from conservatives. He wants to come to the right agreement that increases access and lowers premiums for all Americans.
We do know, though, that the president did say in that Oval Office meeting with some conservatives that are on your same page on this one, look, if this one doesn't get through, my plan, let Obamacare fail, blame the Democrats. We'll see where you get. We know you guys are working around the clock. Congressman Jim Bridenstine of Oklahoma, thank you.
Well, he's right. Obamacare is failing, and we have to fix this. It's not going to be good for America if we just let it collapse. So we're all working towards the same end.
Congressman, thank you. Have a good weekend.